during inspection of the mouth and tongue, we should examine mucous membranes, tonsils, teeth, and tongue. What about mucous membranes? So mucous membrane on the tongue, of the lips, and what you can notice and what is important, sometimes it's a symptom, or sign of angular stomatitis, another aphthous stomatitis or hyalitis, and it could be due to different reasons of this type of damage. Maybe you saw this type of damage in patients and usual people. I don't know, I think that you're mostly living in warm countries. I mean, there's a very warm, but here in our climate in St. Petersburg, this is not a very rare thing, this angular stomatitis, and it could be due to different types of disease. So iron deficiency or vitamin B deficiency or many other diseases that could be underlying this symptom. But nevertheless, it's a pathology. So if you see this angular stomatitis, of course, you can think that it's for sure that something wrong in this patient and try to guess what exactly. What about color of the mucous membrane? You can see here it could be dull red or pale, a little bit pale red, and something looking like this. And here inflammation, so you can compare inflamed with these vessels, which is a little bit more opened due to exudative stage of inflammation and so on. So it's inflamed mucous membrane. It's inflammation, you can see here, so it's exudate. Pale in anemia, you can see here, it's a pale thing. Gingiva is pale here. And icterus and subicterus. Icterus means yellow, subicterus means sub-yellow. So actually icterus in English it's translation like jaundice. So jaundice or icterus. And what is the subicterus? It is when we can't see the yellow color of the skin, but we can ask patient to open the mouth and see the yellow color of the palate, soft palate of the patient here. It's the first place together with sclera, where the yellow color, where this bilirubin and so on accumulates, and we start to see yellow discoloration. After this stage, of course, the skin could also start to be yellow. So tonsils, it's enlarged tonsils. You can see here, normally tonsils are like this. I can see your previous slide. So something like this. It's a normal size. I'm sorry. And here enlarged, inflamed, and covered with these exudative things, with pus thing, and injection of the vessels here. So it's inflammation of the tonsils, acute tonsillitis, or maybe chronic. We don't know. So here a herpes zoster. You can see here these vesicles. Here diphtheric membrane. So it's a fibrinous exudate due to Corynebacterium diphtheria. It's a specific that what you can notice in the mouth. It's a child, I think. Herpes zoster as well. And unfortunately, I don't have all names for the pictures. I don't know why. Scurvy here with the bleeding from the gingival vessels. You can see here it's a scurvy, deficiency of the vitamin C. It's a color, green color of this mucous membrane due to adrenal gland insufficiency. So it's a specific type of discoloration, this black-green color in this type of in this type of endocrine diseases. And measles, of course, you can notice here this signs, and actually the special name is enanthema. Inside, means inside, and when you want to describe a rash of the mucus, you can use this word enanthema. If you say exanthema, it means a rash of the skin, so what is outside. It's usual rule, so that's why don't confuse these words, these terms. Inspection of the teeth. So very in brief, what we can do, of course, we investigate teeth of the patient. We are not dentists, of course, but we do this. Why? Because we are interested in foci of infection, of chronic infection. And that's why we are looking for caries, looking for other damage of their teeth, and that's why we investigate. Of course, we don't do it in such details like dentists do. Of course not. Inspection of the tongue. Tongue is a very interesting thing, and you know that it could reflect many pathological processes. It's not specific, of course, but you should pay attention of the tongue. And very common thing is when tongue is covered with something, so coated or furred tongue. It means that this patient has a severe process, probably inflammatory process, infection, I mean, somewhere, we don't know. It could be stomach, could be intestine, could be skin, or so on. Maybe general infection, sepsis, and other things. But we can understand that this is a severe thing. So that's why I advise you to pay attention of the patient tongue. Nothing specific, but a lot of information about severity of the pathological process. What we should examine, it's a color, it's a moistness, it's a size, shape, and color and thickness of fur. So, so what is the normal tongue? It's red or pink color tongue. There is a picture of normal thing. Something like this. It's close to normal, and I'm sorry. So, and the color could be changed. It could be very pink, so very brightly pink like this. It's a ganthrous glossitis. Probably you know from other subjects about vitamin B12 deficiency, cobalamin deficiency. So you can see here macroglossia. It means macro, it means big, glossia, tongue, so big tongue, a very enlarged tongue due to pathological process. And you can see here that this tongue and this very woman she even can't completely close the mouth due to very enlarged tongue. Unfortunately, it's a disease, and the answer is, what is the disease? Is accumulation of pathological substances inside. These pathological substances in this very patient is amyloid. And this amyloid accumulation in the muscle of the tongue lead to its enlargement. Here also the example of enlarged tongue and how you can understand that the tongue is enlarged. You can ask patient to show the tongue, and you can see here there is no shadows of the tooth, of the teeth here. And in this example, you can notice the scaffold. I don't know how to say. So here are the signs of the teeth that were very close to the tongue. Why? Because tongue is enlarged. So it's a sign of the enlarged tongue, and you should also pay attention of this. Okay, what about cancer? So you can see here a lot of variants, all of them not specific, please. So by by examination of the tongue, it's impossible to make the diagnosis. But again, you should put attention on it. This picture you can find in the web in special atlas and completely investigate. So it's a just example for you that you could imagine how many different things could be.